we're here because, or I'm here because I would like to know about the NAN project. I have learned a little bit about the background story, your family, your daughter, your sister, who passed away due to mental health struggles. Yep. So let's start from there. Normally families would like to remember their loved one, would like to make their death meaningful. Was this the idea behind starting this nonprofit?
Yes, we started the NAN project more than 3 years ago because after the death of Nan by suicide, what we realized is that people don't talk about suicide. And there's such stigma and shame and judgment associated with stigma that young people who may be struggling, and there are so many that are struggling, are afraid to come forward. They don't know where to turn, they don't know how to ask for help, and I just don't want another family to go through what we've been through because of something that is preventable. Suicide is preventable.
Now, when you talk about the stigma, what was that stigma? Did you feel the stigma after your sister passed?
I think there was stigma. She felt stigma growing up. We knew from the age of 14 or 15 years old that she had mental health diagnoses. But because of the stigma that surrounds mental health, she was very resistant to getting treatment. And I think us as a family, we didn't really have the language to talk about her mental health struggles because there's such stigma that surrounds it. We knew very little about depression or anxiety and how to help someone that's struggling.
Now, you said it can be prevented.
Yes.
You strongly believe that suicide can be prevented?
I do believe that suicide can be prevented if we talk about it, if people are educated about it, if we know how to respond to someone who's struggling. You know, it can be as simple as asking the question, are you thinking of hurting yourself? And there's a myth that says that is something that may, let me say this again, it's a myth that if you say something about suicide, it will plant an idea. That's not true at all. It will bring relief to the person who may be experiencing suicidal thoughts. And it gives them the opportunity to know that someone understands what they're going through, or that they can talk about it, that they can ask for help.
So knowing that fact, how do you reconcile your daughter's death?
I think that's a very hard question to answer. You know, I'm not sure I want to go there.
Okay. All right. So you started this project, this nonprofit, to raise awareness, right? We're working in schools. We're reaching out to the young children. Why there?
Because we saw that Nan her struggles were throughout school. And we really needed a jumping off place. So we started our work in high schools. We bring our young adults who have struggled with various mental health concerns, and we work with them to create what we call comeback stories, where they talk about what it was like to be a 16-year-old struggling with depression, or a 17-year-old with anxiety. But more importantly, what were some of those supports that they were able to access either within their schools or within their communities to get onto this path of recovery. We started with the high schools because we needed somewhere to start. But now we're moving into middle schools, we're doing some work with colleges. We're really just trying to spread this awareness around mental health and make this a conversation that people of all ages can have.
Okay, what are we learning about today's struggles, the problems that the youth are facing? I'm sure, not to date you, but what you went through back in high school may look very different from what the young ones are going through right now.
And I'm ancient, but Jake will tell you that it's very different. But what we're learning is that the rates of anxiety, the rates of depression just continue to skyrocket. Kids are struggling at much higher rates, and it keeps going up. Suicide is the second leading cause of death of young people.
Okay. So then we go to the schools. What do we say? What message are we sharing? Tell me about the conferences you have, the discussions that you have with the teens.
Right. So our model, like I said, is a peer-to-peer model. So we have young adults who go and present their stories, talk about what it was like for them to struggle when they were in high school, with the idea of opening up that conversation around mental health and making it something that the students feel comfortable talking about in the classroom setting, making that classroom a safe space for them to open up and ask questions around depression, around bipolar disorder, schizophrenic, whatever that mental health issue is, and making that a comfortable place to talk about it, and more importantly, educating them about where they can go to support themselves or their friends. Who are those trusted adults that they can turn to when they need to?
Okay. Do we know anything when we're talking about stigmas? Who is at risk when it comes to suicide, mental health? Because some people would think, oh, that's suicide. It's a rich person problem, or you know, they have a certain image. But what do we know from the work you're doing?
So I would say suicide is blind. It can affect people of all races, all ages. It affects us all. We do know that men are at 4 times higher risk of dying by suicide, but females are 3 times more likely to attempt a suicide. And that has to do with the means that males use versus females use. But white males aged 35 to 54 tend to be at the highest risk of suicide. But again, it's the second leading cause of death amongst young people. So it doesn't really differentiate among age, race, nationality. It affects us all.
Okay. So when we go to the schools and the peers share their stories, we open up the discussion. What follows? How long do you stay there to make sure that it continues to be a safe place?
Right.
And that is sort of the heart of the NAN project, is it is not a one and done intervention. We open up the conversation, but our goal is to keep that conversation going amongst the students, within the student body. And we do that by bringing into the schools a whole framework for how to continue the conversation around mental health, around suicide prevention, but also around emotional well-being. And we do that with our peer mentors, supporting the students, and often a student group, to hold events, to produce resource sheets that tell students where they can go if they're struggling, to have a stress-less week that they might have 1 week, to do extracurricular kind of activities, and engage students in discussions around mental health. We want to normalize the conversation, and you can only do that over time. Begin to have that cultural shift where people equate mental health in the same way that they talk about physical health, because it is the same thing. It's all about health.
Now, according to CDC, the Center for Disease Control and Prevention, it said that last year, their survey on mortality and life expectancy in the United States found that the national suicide rate is increased and has increased by 33% between 1999 to 2017. Right now, we hear a lot in the media regarding the war on drugs, war against opioids. We are facing a crisis. That's what our current administration is talking about, and the whole nation is responding to this. Do you think we are also facing a crisis when it comes to suicide?
Very definitely. Very definitely.
Absolutely. I think it's all over. Sorry. Absolutely. And I think it's all related. You find most people who are struggling with substance use also have a mental health disorder. So there's a lot of overlap there. And a lot of these deaths by opioids, many of them could probably be classified as suicide as well. So I think it's a very connected crisis that we are facing.
When talking about the opioids crisis, depending on which community you're speaking to, there are those who would say we have been facing a crisis for a very long time. This crisis has not begun today. But the whole nation is aware of it because it impacted a certain person of certain demographics, right? So when it comes to suicide, why do you think, or do you think the same narrative would play in terms of why it's not out there, why the country isn't responding as it should? Because it hasn't impacted the so-called right victim to rally the whole nation.
I mean, I think suicide, you are seeing more discussion around suicide every time there's a celebrity death by suicide. So it is being talked about a little bit more than it was several years ago, but it's also the stigma that surrounds. There's a shame that people who lose a loved one, a friend, to suicide, there's a shame that a lot of people unfortunately feel related to that. And until we kind of take away that and make people feel a little bit more comfortable talking about suicide, that stigma is going to remain there.
So how should we be talking about suicide?
Openly
Openly.
and with a very healthy concern about how we can reach out to young people, anybody who's struggling. How we can, I think one of the greatest protective factors is connection. To, if you know someone who's struggling, or even if you're just not sure, is to talk to, are you okay? How can I help? I'm here, I really care about what's going on with you. So, you know, if you don't want to talk now, maybe we could talk later. But I do care. I mean, it's really making sure that you connect and don't be afraid of it.
Do not be afraid of it. All right, thank you to both of you for sitting down with me to discuss about the NAN project.
Thank you.
Thank you.